Hi guys, welcome back to my channel. I'm Dr. Veena, a full-time NHS GP working in London, and today we're going to cover perimenopause and menopause. I'm going to take you through what it is, how to treat it, and when to seek urgent medical advice. As women, we're going to go through a lot of hormonal changes in our life, and this is absolutely normal. And our bodies will change with the hormonal changes. As you may have noticed, when you start your period, when you're going through conception, when you're going through pregnancy, postpartum, and then later in life when we're done with the fertility part of our life and the hormones change and we're going through the perimenopause and menopause. So what is it? Our ovaries produce hormones, specifically estrogen, that helps keep a lot of systems in balance. As we're nearing the end of our fertility phase of life, these ovaries may not produce that hormone. As we're entering the next phase of our life, ovaries stop or reduce the amount of estrogen that it produces. This means that we may not release an egg, so we stop ovulating. Our periods become irregular. The effects of low estrogen on the body can be varied. I'm going to take you through them head to toe so you can check, are you facing one or more of these symptoms? Some women may have difficulty concentrating, sleeping, focusing at work. You may get symptoms of hot flushes, night sweats. You may get muscle aches, joint pains, cramps, which could be in the muscles or around the gut and the body. You may get urinary symptoms like difficulty passing urine, burning, dryness down below, low sex drive, low libido, vaginal itching, and dryness again. Now, if we're talking about one of these symptoms, you can think we can manage it. But imagine having to deal with a combination or majority of this. It can become a lot. When your periods are becoming irregular in this phase and you have one or more of these symptoms, we call it the perimenopause. When a woman goes 12 months without a period, that's when we actually clinically diagnose the menopause. If you're a woman age 45 and above, we can clinically diagnose that just looking at your symptoms and talking to you. We don't necessarily need a blood test. But if you're in your 30s, early 40s, or there's a family history of premature menopause or premature ovarian failure, we may do a blood test, specifically an FSH level, which could help indicate, are you in early menopause? In the perimenopause, your periods start becoming irregular. Now, this looks very different for each person. Some women may find that the pattern changes, so you're bleeding for fewer days, or your bleeding has become a bit more heavier. You may miss periods for a couple of months, then many months. And this pattern may continue to go like that for a few years where you can't really predict it much and it can cause a bit of an impact on your life. But it's not until you have consecutive 12 months of no bleed that we can actually diagnose the menopause. When it comes to treating this part of our life with the perimenopause or menopause, the average woman in the UK goes through the menopause around the age of 51. The symptoms that we discussed could last anywhere between 4 to 7 years. Again, each of us are unique and it's hard to predict what these symptoms will look like for you or at what point they might get worse or better. So it's always best to discuss this with your personal family doctor. Let's talk about treatment. As with any condition, there are lots of different ways to treat something. In the menopause, the main hormone that we're lacking is estrogen. So we want to think of things that could kind of either mimic some of those benefits or replacing the hormone directly. Firstly, thinking of lifestyle changes or adaptations, as we'd like to call them. Cutting out high amounts of caffeine, spice, citrus foods, nicotine, stress would really help with some of the symptoms. We'd also encourage, obviously, eating a balanced diet, but also increasing the amount of exercise where possible, because that will increase the endorphins in your system, will improve your cardiovascular activity, which is your heart pumping a bit more, and overall might make you feel a lot better in terms of your symptoms. Some practical things you can do is get cooling pillows, have a fan near the bed if you're specifically having the vasomotor symptoms of hot flushes, night sweats. I know some women who keep a mini fan in their handbag, and I've seen them in board meetings holding these fans, and I always think more power to you, because this isn't something we should be ashamed about. It's an absolutely normal physiological process that our bodies go through. We should talk about it more. We should empower each other, educate each other, and really figure what is best suited for our health needs and for our community. When we talk about medication that could be helpful, this is very, very specific to each person, and I'll tell you why. When we think about the medication that can help with menopausal symptoms, this has to be very, very specific and unique to each person, and this is because not everything is going to be safe for you. If you've specifically had irregular vaginal bleeding, liver abnormalities, previous history of any cancer, high blood pressure, it really is going to kind of limit what we can give you and how we give it to you. So you have to go and discuss these options with your doctor so they can put your entire medical history together and discuss what's best. I can take you through some of the options that you can maybe bring up with your doctor or think about or look into when you're thinking about treatment. There are different groups of medicines like SSRIs, tibolone, clonidine that can actually help with some of these symptoms. The evidence isn't as great with these. However, some women have found over long use that the symptoms are managed. This is specifically for women who may not be suitable to take HRT. HRT. Hormone replacement therapy. This has been a controversial topic, a controversial kind of agenda for many, many years. There was a time where we stayed away from prescribing this because of the known risks of HRT. However, in recent years, studies have shown that the benefits outweigh some of the risks, and if used safely, they can actually transform your life in how you're feeling with your symptoms. If HRT is safe for you and it's something you're considering, firstly, it's never in isolation. It has to be in conjunction with a balanced lifestyle, like we talked about in terms of dietary changes and increasing the amount of exercise where possible, but also discussing with your doctor what the best kind of route might be for you. We want to replace estrogen and progesterone in our body, and the way you can do this can be via gels, patches, tablets that have different concentration of the medicines. You're going to be reviewed at 1 month, at 3 months, regularly to check your BMI, your blood pressure, and any side effects that you might be having with the medication. There are some contraceptive methods that can also contribute to HRT treatment, specifically the Mirena or the hormonal coil, which could provide the progesterone component of your HRT. And then, if that's what you use, you may just have to use the estrogen part, which could be either a gel or it could be a patch or a tablet, depending on what you prefer. Having listened to this, if you now have looked at your symptoms, your periods are getting irregular, you're having some of these signs and symptoms, and it's impacting your day-to-day functionality and your life, you want to go speak to your GP, discuss what options are available. They're going to probably do a blood test, check your history, do a BMI check and your blood pressure, and discuss with you what the best options might be. Remember, it's not one hard rule for everybody. It's not one size fits all. You might have to kind of tweak what you start, and then it may change. And again, you're not going to need it for the rest of your life. You may need it for a couple of years or a couple of months. It is important to say that there are risks with HRT. However, the risks are with prolonged use over a long period of time, and the risks are higher if you already have other medical conditions or if you have things in your social history like being a heavy smoker. So these are things to really think about when you're considering using HRT. Patients have described to me things like, I'm losing my mind. My husband said I'm batshit crazy. I want to strangle someone. These are the words they have literally used in clinic when they're trying to describe how out of control they feel with their bodies. I've had women who felt ignored for several years or felt like their symptoms have not been really paid attention to. If you're someone like that or you know someone like that, I'd really encourage you to take your symptoms to your doctor and say that you might be worried about being in the perimenopause or menopause and you'd like some treatment for it, because there really are options available and you do not need to suffer. Your menstrual cycle may have paused, but your life does not need to. So I'd encourage you to really fine-tune the treatment and changes to your lifestyle where you can have a very good quality of life and still enjoy womanhood in all its forms. If you have gone through the menopause, which is 12 months of no period, and then you have a sudden bleed at any point, this is a medical emergency and you need to contact your GP quite urgently, because it might require us to refer you to get an urgent scan to have a look at your womb. So once you've gone through the menopause, you should not be having a bleed. The only instance where you may is if you've been started on hormone replacement therapy, and in that case your doctor will kind of give you advice and tell you that this is something to expect. However, if you've gone through the menopause, you're not on any hormonal replacement therapy, you're not on any medication, and then suddenly you notice a bleed, you need to speak to your doctor. I hope this video has helped you understand what the perimenopause and menopause is. I hope you understand it's a completely normal part of being a woman and part of our biology, and that you have some idea of what the treatment options are and what you can do to make yourself feel a bit better. Feel free to leave any questions below and I'll do my best to answer them. Thank you so much for tuning in.